Welcome. Today we're diving into atrial septal defect, or ASD, a congenital heart defect. Join us as we explore what ASD is, what causes it, how it affects the heart, and what can be done about it. Let's begin. So, what causes an atrial septal defect? Essentially, it's a birth defect, meaning it's present from birth. The exact cause is often unknown. However, genetic factors can play a role, and it can sometimes be associated with other genetic conditions, such as Down syndrome. Environmental factors during pregnancy may also increase the risk, but definitive links are still being studied. Now, let's understand how ASD affects the heart. Normally, the wall between the two upper chambers of the heart, called the atria, is completely sealed. This wall, or septum, prevents oxygen-rich blood from the left atrium mixing with oxygen-poor blood from the right atrium. In ASD, there's a hole in this wall. This allows oxygen-rich blood to leak from the left atrium into the right atrium. This extra blood then flows to the lungs. Over time, this extra blood flow can strain the heart and lungs, leading to various complications. ASD isn't super rare. It accounts for a significant percentage of congenital heart defects diagnosed each year, making it one of the more common heart defects seen in children and adults. While the exact prevalence varies depending on the study and population, it's definitely a condition that healthcare professionals are well versed in recognizing and treating. What are the signs and symptoms of ASD? Well, it varies. Some people with small ASDs may have no symptoms at all, particularly in childhood. Larger defects might lead to symptoms like shortness of breath, especially during exercise, fatigue, frequent lung infections, like pneumonia, heart palpitations, and swelling in the legs, ankles, or feet. In infants, it may cause poor feeding and slow growth. How is ASD diagnosed? Usually, a doctor will first suspect ASD based on a heart murmur heard during a routine checkup. Further tests are needed to confirm the diagnosis. An echocardiogram, which uses sound waves to create a picture of the heart, is the primary diagnostic tool. Other tests, like an electrocardiogram ECG, chest X-ray, and cardiac MRI, may also be used to assess the severity of the defect and its impact on the heart and lungs. There are several types of ASD, classified by where the hole is located in the atrial septum. The most common type is the ostium secundum defect, located in the middle of the atrial septum. Other types include ostium primum defects, which are located lower in the septum and are often associated with other heart problems, sinus venosus defects, which are located high in the septum, and coronary sinus defects, which are quite rare. Treatment for ASD depends on the size of the defect and the symptoms it's causing. Small ASDs may close on their own over time and require only monitoring. Larger ASDs typically need to be closed. This can be done surgically, by patching the hole or, more commonly, through a less invasive procedure called catheter closure. During catheter closure, a device is inserted through a blood vessel in the groin to seal the hole. Medications may also be used to manage symptoms like heart failure or irregular heartbeats. Unfortunately, there is no guaranteed way to prevent ASD since it's primarily a congenital condition. However, women planning to become pregnant can reduce the risk of birth defects in general by ensuring they are up to date on vaccinations, avoiding alcohol and tobacco, and maintaining a healthy weight. Genetic counseling may also be helpful for families with a history of heart defects. The prognosis for people with ASD is generally good, especially if the defect is diagnosed and treated early. Many people with treated ASDs live normal, healthy lives. Untreated, larger ASDs can lead to complications such as pulmonary hypertension, heart failure, and arrhythmias. Researchers are constantly working on improving diagnostic and treatment techniques. For example, new and improved closure devices are being developed for catheter-based procedures. Genetic studies are also underway to better understand the causes of ASD and potentially identify ways to prevent it. Thanks for joining us to learn more about atrial septal defects. We hope you found this informative.